Hello, thank you for finding the time to join us on this Facebook Live event. My name is Victor Ayara. And as usual, what we do is we try to bring you much needed information about the situation that we find ourselves with COVID and, of course, every other thing that has to do with health. And this broadcast is brought to you by 10,000 Family Study of the University of Minnesota. My name is Victor Ayara, and there is our website. If you want to find out more about 10,000 Family Study, you would go to that website, which is www.10kfs.umn.edu. But you don't have to do that right now. I wouldn't want you to do that right now, because right now you're going to be hearing from an expert who is my guest on this edition of the program. And we will be talking about COVID-19, to test or not to test. Of course, there's been a lot of talk, a lot of controversy, a lot of questions. You should go to test to see. I mean, there are two types of tests, but I'm not the expert, so I'm not going to say it. But of course, to find out if you have COVID or if you're asymptomatic or you have it or don't know it, just wait. I am not the one to answer those questions. I know that a lot of people have had, indicated that they're going to join us today. And for some of those that showed interest, we want to thank you very much because, of course, you are the reason why we are doing this. So wherever you are joining us from, be sure to stick around till the end of this program. And we are going to have a surprise gift. It is going to be an Amazon gift card at the end of this show for whoever the lucky winner is. We're going to do a random selection and somebody's going to go home with an Amazon gift card. Now, my guest on this edition of the program is someone who doesn't like viruses. As a matter of fact, he hates viruses. He never went near anyone or anything that had to do with viruses. But now he has been in the unenviable position of leading research into finding answers and to finding cures. Let me introduce you to Dr. Bharat Thiagarajan, who is an associate professor in laboratory medicine and pathology and director of the Division of Molecular Pathology and Genomics at the University of Minnesota. Now, until 2020 BC, now 2020 BC means 2020 before COVID. His research interests were centered around development of new biomarkers in blood for early identification of a variety of chronic diseases, such as cancer, cardiovascular, and lung diseases. Now, since March 2020, he has been involved in the development and implementation of the SARS-CoV-2, that is COVID-19 antibody tests, and the SARS-CoV-2 virus testing at the University of Minnesota. His interests outside of work include spending time with his family, hiking, running, and of course, photography. Welcome, Dr. Bharat Thiagarajan. Thank you very much for joining me, sir. How are you?
Thank you, Victor. Thank you for that nice introduction.
Oh, I didn't know if that was nice, but thank you. So, tell me, sir, you have been working in this field, even though coronavirus is still a new field. Everybody's trying to wrap their heads around, experts inclusive. Now, what are you most passionate about this work? Why are you doing this, the work you're doing right now?
Well, I think, for me personally, the reason I do this work is because it gives me an opportunity to make a difference in people's lives. And in my research work, um, the fruits of my work take many decades to come to fruition, and it takes a long time to see changes happen. Whereas with this work in the pandemic, the results are more or less immediate. I started working in March, and the tests that we've developed and implemented at the university are currently being used to detect, COVID-19 infection, and so that's very gratifying, and that's something I'm very passionate about in this line of work.
Well, I can see that you're very passionate about it. And you also are a very patient person. I mean, to do research takes some level of patience. And thank you very much for the work that you do. Now, tell us, we've been hearing COVID-19, COVID-19. What is it about the name COVID? How did the science community come about that name?
So COVID-19 stands for coronavirus. So CO stands for the corona, VI stands for the virus, D stands for disease. So it's coronavirus disease. And it was first identified on December 31st, 2019. And so hence the name COVID-19 for this disease.
All right. Thank you very much. And for a disease to qualify as a pandemic, what are those parameters? What makes a disease? Why can we just say it's a flu, or it's some kind of something that passes on from one person? Why do we qualify this as a pandemic?
So any disease that spreads globally, qualifies. Spreads globally very rapidly, qualifies to be called a pandemic. And the World Health Organization on March 11th of 2020 declared COVID-19 to be a pandemic because of the rapid spread of this disease across the globe. WHO still calls this a controllable pandemic, and that individual countries can take measures to limit the spread of the disease. And so they still call it a controllable pandemic at this point.
All right. Controllable, but still spreading. Yeah. And if you can just give us a little bit of, I know we hear a lot of things about the news. It has been like the most topical issue all over the world, but what is the most, what are the ways that people are most likely to spread this virus?
The most common ways of spreading the virus are really through droplet-like transmission. So when people are talking, sneezing, any transfer of particles from the mouth or the nasal passage or nose. Those are the most common ways in which the virus spreads from person to person. And hence the recommendations for maintaining social distance to 6 feet, as well as masking, that limits the person to person spread of this virus.
Okay. Well, so this is the thing. I am going to borrow the BC that one of the producers, Andrea, inserted in that script. So for March 2020 BC, what you're telling me is that initially it was okay for you to sneeze and people would say, bless you, right? But now, so when you sneeze, people run away, people leave the room, people leave the area. And so when you go, and people are like, okay, excuse me. Is that what's really happening here, Bharat?
Likely, yes. I mean, I don't know, I had to travel in March, and when I was traveling, I was just terrified of either sneezing or somebody else sneezing right next to me, or even coughing for that matter. Because, this heightened awareness that this virus can be spread by those means. I mean, in a lot of ways, it is not terribly different from how you get a common cold or the flu virus. These are the exact same mechanisms through which any respiratory disease is spread. It is just the numbers of people who get really sick and end up going to the hospital that scares people about this, even though a vast majority of people who get the COVID-19 virus actually recover without bad consequences. It's only a small proportion of people who end up going to the hospital. But that small proportion of people still now have accounted for, 150 plus thousand deaths in the US alone. So that's a lot of stress both on the healthcare system as well as loss of life for families, and that's the real burden for this disease. Not that you get COVID infection, but the small proportion of people that end up going to the hospital and consuming healthcare resources and eventually that leads to loss of life. That's the real concern here.
Yes, it is a concern. And I just wanted to ask you the question because the reason why we're here, I mean, the main topic of our discussion today is to test or not to test. So my next question to you would be, tell us what kinds of tests people should take or people are taking and how effective are those tests? Because do not forget that within this past week, I'm not sure if it was last week or this week, but a governor of a certain state, I'm not going to mention, actually tested positive and then tested negative and then tested positive again. And I'm sorry, negative again. I mean, yeah, it's kind of confusing. So what are those tests that people should be taking, and what are those tests that people are taking, and how are those tests actually helping right now?
Okay. The test for the COVID-19 infection, I will divide into two broad categories. One is for testing of the infection itself, of the virus itself, which tells you whether you have the infection now, currently. And the second is the testing for antibodies, which tells you whether you have been exposed to this virus in the past. It does not mean that you currently have the infection, but that you had the infection sometime in the past. So when people talk about testing, the most common type of test that everybody refers to is the testing for current infection, testing for the virus itself. So the most common way in which that is done is something called a PCR test, or testing for presence of the virus particle. And this test is done typically in specialized laboratories. So, you take a sample, and the sample can be either a nasal swab, or it can be a saliva sample, or it can be a swab at the back of your throat. Any of these samples are then taken and then sent to a central lab. The lab does the testing and gives you back the results. And this process typically takes 3 to 5 days. And if you've been following the media, you must be aware that there's a lot of capacity problems in being able to do large numbers of tests using this model. So these PCR tests tend to be fairly sensitive, but because of the problems in getting adequate sample from your nose and stuff like that. I mean, sticking up a swab up your nose is not a pleasant experience for anybody who has done the test. And so you may get a negative test because the sampling wasn't adequate, for example. So there are many reasons in which you can get a false negative test. But the
Okay.
PCRs are considered kind of the gold standard for detecting COVID-19 infection. Now, the other types of tests that you can, that are, I anticipate will become more common in the near future are what are called these rapid antigen tests. So these are
Okay.
tests where, hopefully you will be able to do the test in the comfort of your home. You can take a sample, like similar to a pregnancy test, uh, put that sample on a piece of paper and you should be able to see whether the paper changes color or not, and changing color should be a positive test. So these are rapid antigen tests, and they also detect the presence of virus, and they
Okay.
typically tend to be less sensitive than the PCR tests. So compared to PCR, they probably detect 80 to 90% of the tests of positive cases. Um, but the big advantage is one, it can be done very quickly, and you
Okay.
can do them at greater frequencies. Since they tend to be cheaper, you can do them every week if you want. Um, and so that is probably another type of test that uh, will become more frequently used in the future.
Well, that sounds very good. I mean, if we can actually test for COVID the way that women test for pregnancies, that would be something that would go a long way. I mean, especially because from what you're describing, I don't think I want to take that test. It's not like I've exposed myself to, situations that I would need a testing. I probably would need testing for antibodies, as you mentioned, because I took ill sometime in February, and I have never felt that way before. And to be honest with you, as an African who lives in America, I still have some very potent practices, like, of course, the steam, using the steam to cover myself, and garlic and ginger ground and with lime and honey. That was my main fluid intake for that period, but I got better. But to say that I actually went to the hospital to test for corona, I never did that. So I think that if we, just to go back to what you're saying, if we can have a situation where people can perform those tests by themselves, that would be great. Let me take this question from Tammy. Tammy said, first, thank you for having this. And I thank you very much, Tammy, for taking the time to join us. She said, I think the more information we get, the better. My question is, I'm tired of hearing that this will go away. I don't think it will, but in your professional opinion, that would be you. That would be you, Bharat, not me. I'm not the expert here. I, in your professional opinion, do you think it will, or is this another virus that we will have to adjust to? Can you answer Tammy's question,
Yeah, I think,
please?
early on in the pandemic, there was some thought that, with the change in the season, that um, the coronavirus, like many other viruses, uh, would kind of die out, and maybe it'll come back, in the winter months or something like that, when we would have had a chance to be better prepared. Um, but I think those theories have largely been disproved by the continued spread of coronavirus globally. And I don't, in my opinion, I don't think this is a virus that's just going to die out at this point. Um, and this is something that we will need to learn to live with over time. Um,
Hmm.
I do anticipate that uh, there will be a vaccine. How effective it will be, how long the immunity will last, nobody knows. I think there are very smart people working on these questions. But even if there is a vaccine, um, I think this is a virus that's come into the human population and established itself. And it is something that we are going to have to learn to live with and adapt ourselves in the future.
Well, Bharat, you don't look like someone like that brings bad news, but I'm not encouraged at all by what you just said. It
I mean,
doesn't
I
look
don't
like
mean to
it's going
be,
away.
I don't
I
think, it is
know.
necessarily a bad thing to say we have to learn to live with this virus.
Mhm.
We as a
So
species have adapted to so many different challenges, and
I agree.
this is another challenge that we will adapt to.
So
Um,
what you're saying is that Corona is like a guest who visited and said, and you were thinking that maybe they're just going to stay for a few days, especially if they are an obnoxious guest. You're thinking they're going to spend a few days and then they end up spending a week and it's a month and then months and then, oh my God, what's going on, Bharat?
well, yes, and you stay with an obnoxious guest long enough, you get used to its ways, and you learn to adapt your life to live with them. So I think there will be some degree of compromise, between the vaccine efforts, between the efforts to develop treatments for people who do get sick,
Right.
um, and us as a community changing our behavior, with appropriate amount of social distancing and masking and things like that. All of these things together are going to help us, um, come back to some sense of normalcy. Whether that normalcy looks anything like what it would look before, um, the pandemic, that I am not sure. But I think, I am hopeful that we will reach some level of normalcy that
Right.
we can all say, okay, this is the new normal and we will live with it, kind of
All
thing.
right. So, Bharat, as of this time, as of this material time that we're talking, over 5 million cases reported in the US and over 165,000 people have died. 165,000 people have died. And that is according to John Hopkins. And how important is testing? And how about compared to social distancing, the wearing of masks and other PPE measures? How important is testing at this time?
So my opinion is, that testing is not a replacement for masking and social distancing. Uh, Testing is one of the tools that is available in our disposal to try and control the spread of virus. So if you ask, when should you get tested or what is the role of testing? Right now, the recommendation for testing for the virus is that when you have symptoms, so usually when you have a cough, a cold, a fever, trouble breathing, any of these symptoms are in some cases just gastrointestinal symptoms, nausea, vomiting, diarrhea, the kinds of things. Um, those are good enough. Those are reasons for which you should get tested if you're symptomatic, if you don't feel well. There are some situations where asymptomatic people are recommended for testing. So one is when a public health worker contacts you and says that you've been exposed to another person who tested positive for the virus. And in some situations, there are some medical procedures that will require you to undergo the COVID virus testing before you undergo the medical procedure. That's probably, currently that is the recommendation. And in future, there may be uh, recommendations that are coming out for testing of asymptomatic people as well. But I want to emphasize that, more testing does not imply that you don't have to follow the
The
other
precautionary
things like
measures.
social distancing and masking. Irrespective of how much testing we do, we need to do all those things.
I totally
Now,
agree with you.
for the antibodies, when should you do antibody testing?
Okay.
Right now, the role for an individual, whether the clinical management of the disease or changes, whether you have antibodies or not, that is really unknown. And so from at this point, the role of antibody testing is really in the realm of public health professionals, where they want to understand the spread of the disease in the community over time. And there is not a whole lot of data to suggest that knowing your antibody status will actually affect the clinical management of your disease. So in our lab, for example, we do a lot of antibody testing, and there is a substantial proportion of people who come in mainly because they are curious. They've had, like Victor, you said, they had symptoms consistent with COVID in February, March time period, and they would like to know if they had COVID infection at that time point. The other aspects of this is, there is people who blood donors who want to donate convalescent plasma, who have recovered from COVID-19 infection and want to donate convalescent plasma. Those people need to get tested for antibodies to make sure that they actually had COVID-19 and recovered from it and developed an immune response. So there are certain situations in which antibody testing is important, but for a vast majority of the people, it does not affect what happens clinically.
All right, Bharat, thank you very much. So you, in one breath, answer the questions that were posted by one of our viewers, Monica. She actually asked about the testing for COVID as well as for antibodies, and you did a great job answering those questions. So there has been a lot of talk about testing and contact tracing. I don't know what contact tracing is, and I know that there's so many people out there who do not know what contact tracing is. Just like my 3-year-old son, for the first time, when we went out and he saw a lot of people with masks, was thinking that everybody was playing ninja. So tell me, what is contact tracing, and how effective is this in, of course, stopping the spread?
So contact tracing really just refers to the ability, not the ability, the process of talking to people. So for example, if you tested positive for COVID-19, for example, a public health worker will call you and ask you who else you have been in contact with in the last, say, 3 to 4 days. And you would provide a list of people you have been in contact with, and the public health worker would then contact those people who you had been in contact with and inform them that they have been potentially exposed to COVID-19 infection and ask them to get tested, and also limit their exposure to other people till the results of the test come back. So contact tracing has really been the bedrock of trying to prevent the spread of infections in public health for a long time. I don't know, maybe a century or so. And so it's the same, it's a tried and trusted technique that works. And that's what a lot of countries that have successfully contained the spread of coronavirus, COVID-19 have done, which is to combine testing with contact tracing to limit the spread of the virus in the community. And that is what we in the US are also trying to do.
I appreciate those answers. Thank you very much. And what about just going back to testing now? What do you think about the availability or non-availability of testing? And is it really happening now? Because a lot of people would say that there's too much testing. Some people would say, "Oh, we're not tested enough." What is your opinion?
Um, I think, whether there's too much testing or not enough testing really depends on the context. And more than just the absolute numbers, it's also important to test the right type of people at the right time. Um, for example, in the United States, if you look at us as a nation, um, there because of like shortages in testing supplies, a lot of the commercial labs have been returning results 5, 8, 10 days after the test has been done. And testing done in that, returning results in that time frame really doesn't help with contact tracing and quarantining and stuff like that. And so if the test is not done and reported in, say, within 48 hours or 72 hours, then it doesn't matter how many tests you do, you're not doing the right type of testing to really limit the spread of the virus. And so, how many tests? I don't think there is a silver bullet as to say how many tests you need to do to control the spread of the virus. I think thinking of the testing more holistically in the context of the other public health measures that people take. With, for example, contact tracing, is the population or the community in general adhering to recommendations regarding masking and social distancing are all important components that determine how much tests need to be done in the community. So
You did mention about testing the right people who really needs to get tested at this point. Yes, of course, some people are not feeling sick in any way and they don't have the need, they don't feel the need to be tested. And if they do feel the need to be tested, maybe because of maybe they expose themselves in one way or another to someone who is suffering from corona, are they able to get tested? Can anyone who wants get tested?
I believe the answer to that question is yes. I think anybody who wants to get tested at this point can get tested. And there are actually several resources. The Minnesota Department of Health provides a listing of places where you can get the testing done. So there are two types of places where you can get the testing done. One is the Minnesota Department of Health provides a map of all the clinics and health systems that provide testing. And at this point, I think a lot of clinics and almost all major health systems uh, uh, provide this kind of testing. The second is through community partners. So Minnesota Department of Health has a link on their website where you can get free testing done, free virus testing done in the context of community partners, in collaboration with community partners. And every week, I think they hold these events at different places and people can go and get tested if they want.
Okay, so we have another question from our very distinguished guest, one of our distinguished audience members, Elaine. and she's asking, is the loss of smell and taste as good an indicator as a fever for a potential COVID-19 infection? I'm going to read that again. Is the loss of smell and taste as good an indicator as a fever for a potential COVID-19 infection? Bharat?
So the loss of smell and taste is actually a very specific indicator for COVID-19 infection, but it's not necessarily a very sensitive indicator. And for that matter, neither is fever. And by what I mean by that is only around 50% or less of the people with COVID-19 infection ever have a fever as a symptom. And so, yes, if you have a fever, you're suspicious about COVID-19 infection, but fever can be because of a lot of different reasons. So fever is neither sensitive nor specific. The loss of smell and taste is probably a little more specific than fever, but it's still not a very sensitive indication of that you're going to have that you have COVID-19 infection. So the best way to figure out if you have a COVID-19 infection is actually to get yourself tested and not guess whether you have it or not.
All right, I appreciate that answer, because if we are going by taste and smell, trust me, you know that some places you walk into and you wonder if the person who has or who occupies that space has lost a sense of smell. So sometimes it might not be a good indicator. When it comes to taste as well, I have also gone through some very unfortunate, being in unfortunate circumstances where I eat in a place where the food was not very palatable. And of course, so that could affect the way you look at COVID. If the food is not tasting right, you can lose your sense of taste. So I think that the fever I would stick with the fever, Bharat. And so some people say, why can't we just let COVID-19 run its course and quit putting all the limitations on people's lives? I mean, I can relate. What do you say, Bharat?
So it's, I think we should realize what running its course would really mean. When we say run its course, we are saying let most of the population get infected, let 70 to 80% of the population get infected, let's develop herd immunity, and then we no longer have to worry about the health consequences of COVID-19. And to understand the implications of that, you have to consider where we are in the course of this disease, which is with 150,000 people, who have died, 100 and counting. Still, the population prevalence, the numbers of people who have been exposed to COVID-19 virus is still around 5%. In some pockets, it may be 10, 15, 20%, but as a nation, we are still far below even the 5% level in terms of the numbers of people who have been exposed. And even with such low exposure rates, you still have 5 million cases and 150,000 plus deaths. You can see, on the news and in the media, how much strain this has caused to the healthcare system in terms of ICU beds, hospital beds, testing capacity, and so on and so forth. And so for us to get to 70% of the population being infected, that's going to result in, frankly, ungodly amount of both hospitalizations and deaths. And the whole goal here is not necessarily to prevent COVID-19 infection. It is really to prevent deaths and hospitalizations, or at least spread the hospitalization over a period of time so that we can treat the people who do get sick and prevent the deaths. And for those reasons, I think, when people say let it run its course, we need to put it in perspective of where in the pandemic we are and what it will take for it to run its course.
All right. Thank you, Bharat. And another distinguished audience member, Heather, is asking this question. How soon do you think the rapid test will be available? How soon?
So the FDA has actually approved two rapid tests, two antigen tests for market, and it's already available for use. And there are, I believe, there's a consortium of 6 states. The governors have gotten together and they are implementing these rapid antigen tests in those states. Minnesota is not yet one of them, but I think more and more states are joining them. But I think even with the, sometime in the fall is when we anticipate a lot more of these rapid antigen tests to become available. There isn't an exact time frame for when this will happen, but the anticipated date is sometime late in the fall, in October, November time frame, is when the more antigen tests will be available.
Late in the fall is still close. I mean, time flies by fast. Now, if you're just joining us, thank you so much, Bharat. If you're just joining us, it is to test or not to test. We're talking about COVID-19 testing with expert Bharat Thiagarajan. And of course, this is brought to you by 10,000 Family Study of the University of Minnesota. Did you remember when we started this program, I did promise you that if you stick around to the end of the program, there is an Amazon gift card up for grabs. So don't go anywhere because we are still here and we are getting very expert responses from Dr. Bharat Thiagarajan. Now, a lot of weird things have been said, Bharat, about COVID-19. I remember when people would use their 5G network and get on the social media and say that this is about 5G installations and that this is a new world order and something is going on in the spiritual and the supernatural realm that we don't quite comprehend. We poor mortals don't understand. What are the weirdest things you've heard? Which of them would have made you? In fact, some people even talked about Corona beer, right? And like, are you drinking Corona beer? And I'm like, yes, I have drank Corona beer. And I have a cousin who lives in Corona in California. And, they died. These guys died. But this is the thing. What are the weirdest things you've heard? And which of those things got you concerned? Which of those things gave you a good laugh?
I think the one it's the same thing that made me laugh and also concerned when people actually started doing it, which was considering drinking bleach to kill the coronavirus. I laughed when I first heard about it. And unfortunately, I also heard later that there are people who tried it. With not so good consequences. So yeah, that probably took the cake in terms of weird things that have been said about coronavirus. That's made me laugh and concerned at the same time.
All right. Well, let's talk a little bit about 10,000 Family Study, because it would be remiss if I don't mention the 10,000 Family Study, which of course is the platform that made it possible for us to have. This is the second event in a row, and I've also been told by reliable sources that we might have another event sometime in October. I'll get the details before we end this broadcast. So tell me, how is what you're doing right now tied into what you do on a day-to-day with 10,000 families? I understand that you work with cancer survivors too. How is this affecting people living with cancer and the work you do at the 10,000 Family Study?
Yeah, so the 10,000 Family Study is really a broad uh, community and population-based study that seeks to recruit participants from all over Minnesota. And I think population studies such as the 10,000 Family Study um, really can play a valuable role in understanding, one, the prevalence of COVID-19 infections in uh, different communities throughout Minnesota. So if you look at where a lot of the testing for COVID-19 has been done, it has been done mainly around the Twin Cities and urban areas. And not a whole lot of testing is being done, um, in rural areas or in specific underserved communities. And these are specific situations where population studies such as the 10KFS can really help understand, uh, help further the understanding of the spread of this infection in the communities. The second area where I think 10,000 Family Studies and studies such as this can help us, can shed some light is understanding the long-term consequences of COVID-19 infections. So we know that a lot of people are infected, a vast majority of them recover without any serious health consequences. But what are the effects of this viral infection on the immune system? Are there long-term consequences for heart disease, stroke, which some people experience immediately, but the people who recover at increased risk for these conditions at a later time point? These are scientific questions and real world health problems that need to be addressed. And these are probably best addressed in the context of population-based studies like 10KFS. And so that's, this is how I see my work in 10KFS being tied into the work I do with with the COVID-19 infection detection stuff.
Thank you very much, Dr. Bharat Thiagarajan. And you have done a great job on at least telling us about COVID. And also, it is very important that we also highlight that the 10,000 Family Study, everything that is happening within this period is being closely monitored and looked at, as they could have any kind of for whatever kind of effects they could have in the communities and the families that are being studied. So you can get more information from 10kfs.umn.edu if you log onto the website. And should you have any questions as well, the email address would be popping up soon. And so that way you can also send us information, send us your questions, and we will be more than glad to hear from you. Also, Dr. Bharat Thiagarajan is also available to answer those questions even after this broadcast ends. So the email address is 10kfs@umn.edu. That is 10 like TENKFS @umn.edu to get all of your answers to those questions. Now, let me ask you, still on 10,000 Family Study, what are you working on currently, or what were you working on before this disruption came on, Dr. Bharat?
So my work was primarily focused on looking at the health consequences in cancer survivors, the long-term health consequences in cancer survivors, using the 10K family study as the foundation to recruit all these cancer survivors. So I was actually interested in looking at what are the long-term complications in terms of heart health and cognitive function among cancer survivors, and whether the rate at which they age, the biological age, not just how old they are, but the rate of biological aging in these cancer survivors could be used to predict how many health problems they have, after a few years of surviving the cancer. And we were using the 10K family study to recruit these cancer survivors into the study and following them up over the long term.
All right. Thank you so much for that answer. Now, if we have people in the audience that would like to participate in any of your projects, who should they contact? Bharat, how do they get to be part of the work that you're doing?
I think the best way to get in touch with us and get involved in the studies that we are doing is to send an email to 10kfs@umn.edu, which is tenkfs@umn.edu. I think if you send an email, we will get in touch with you and explore what are the best possible ways in which you can contribute to this kind of research that we are doing.
All right. Thank you very much. And we've also heard that companies are testing vaccines against COVID-19, some of which are giving good results. How long will it take till a dependable vaccine is ready and widely available? What's your opinion?
If I knew that answer, I would be rich now. But my bias, my opinion is that we will have some sort of a vaccine available for public distribution by the end of this year or early next year. Now, the big question is going to be how effective is the vaccine going to be, and how long will the effectiveness last? And so the answers are unlikely to be fully known by the time the vaccine is released. But it is unlikely. I mean, this is just guess, but I don't think there will be a vaccine that provides lifetime immunity with 90-95% effectiveness in December of this year. More likely, we are going to see a vaccine that is semi-effective in a substantial proportion of the population, maybe 50%, maybe 60%, maybe 70%, and where the immunity lasts at least for 6 months. And so something similar to a flu vaccine, if you will. And then maybe that will give us time to develop other vaccine strategies that are more long-lasting and more effective in the future. But that's my hope for the immediate future, that some kind of a vaccine will be available by the end of this year.
Well, that is a shared hope, Bharat. I also share that hope 100%, even though it sounds scary that we are still, nobody would have thought that at this time of the year of 2020, we would be in a position that we're in now as, when we say we, not just in the US, but all over the world. Now, I have been reliably informed. I did tell you that we have another event, and it's actually slated for October 14. So please mark that date, October 14, same time, 4:30 p.m. Central Standard Time. And this time we're going to be talking about healthy child and adolescent development. You don't want to miss it. Are you a parent? Are you a guardian? Are you a brother? Are you a sister of an adolescent, of someone who is in that age where we think that our moms and dads don't know anything? Trust me, we've all been there. Where we begin to show, a lot of rebellion, if you like. So, healthy child and adolescent development. That is going to be the topic we're going to discuss. We were going to send out the materials as soon as possible. The date again is October 14. Now, to come back as we come to the beginning of the end of this broadcast, what suggestions do you have for people or families about their health based on your work with COVID-19?
I think there are particular groups of people who are at increased risk for complications or, worse outcomes with COVID-19 infection. For example, people who are obese, people who have hypertension, other health conditions that put them at increased risk for worse outcomes if they have COVID-19 infection. And while there are general recommendations regarding masking and social distancing that we give to everyone, these are conditions that are actually under an individual's control, where they can, it is under their purview to try and minimize the risk of a worse outcome from COVID-19 infection, and encourage people to do things that everybody tells them to do anyways, which is to eat a good diet and exercise, and reduce the chances that they are at a higher risk for having a worse outcome if they get a COVID-19 infection.
All right. Well, I wanted to say that everything you said is correct. You are, besides work, what do? You like to run, you like to hike.
Yeah.
You are a far healthier person than I am. So what is the motivation? How do people like us get off the sidelines and start running around? And, how do we do it? Advise me, sir, just in the last few minutes that we have before the end of the show.
Yeah, that is a good question, Victor. And it is tough. On one hand, you say you have to practice social distancing. On the other hand, I am saying also get out and do something. And so, I'm not sure I have a great answer for you as to how to do it. And I think it is a personal challenge that all of us have, and the answer is going to be different for each person.
All of us, I know you're trying to make me feel not too bad, consolation. I get it, but I will work on it. I'll find my motivation somewhere else, because apparently you're not about to motivate me. You're just trying to console me. But it's okay, Dr. Bharath Thiagarajan. Thank you so much for taking the time to join us today. It's been awesome. I'm going to let you go, but we have a winner. And our winner today is Temi Dial. Is it Dial or Dial? Temi Dial. Temi, our team will reach out to you with the Amazon gift card. Wow, congratulations. You have emerged our winner for today. Thank you so much for participating, and for every other person who joined us. But right before I let you go, if you had a magic wand, it's just going to be a one answer question. If you had a magic wand today, what disease would you cure? If you're able to just wave it, what disease would you cure?
I would cure dementia.
Dementia. Thank you very much. Thank you very much. My guest has been Dr. Bharat Thiagarajan, and my name is Victor Ayara. I thank you all for joining us to have this conversation, all of our audience members who participated, and of course, the winner, Tammy Dale, thank you so much. Until we come your way on October 14, keep a date with us, and do not forget, stay safe in this time. Thank you, and bye-bye.
Thank you.